Welcome back. Pregnancy for a woman can be somewhat uncomfortable, and if you have aches and pains you never thought you would have. Also, having a little one grow in your tummy can cause a lot of strain on your back. To alleviate some of that strain, chiropractic care can be the solution for you. That's why we have advanced chiropractic doctor Jason Raesz here to tell us a little more about the benefits it could have on your body. Well, thank you for joining us today.
Thank you for having me, Marlena. So first, I just want to go over some of the mechanical things. And so this is a plastic model of the spine. This would be more of a normal low back curve here. Now, whenever you're pregnant, of course, the average weight gain is 25 to 35 pounds. So add 25 or 35 pounds out here, and guess what happens to the low back? Well, it increases the low back curve. As that increased curve happens, there's a bunch of nerves that come out through here. And when these nerves start to get smashed or damaged or pinched, that's why so many women develop low back pain during pregnancy. These are the same nerves that travel down into the legs. So this is also why so many pregnant moms develop this sciatica or this pain going down the back of their legs. These nerves in this area also go into the pelvic organs. So these are the nerves that control and help the baby to grow and go into the uterus. If you have a nerve that's being smashed or damaged, I mean, what kind of mom wants their baby to have, where they're not getting 100% nerve flow to the baby or to the uterus?
Right.
So as a chiropractor, we evaluate this area and we start to adjust it and correct it and get pressure off the nerves to help alleviate that low back pain and help people, get out of pain, help get rid of the sciatica, and help the baby to grow at 100% and be 100% healthy through the pregnancy.
I might be jumping a little more, but after when you're pregnant, because the spine is pushed back like that, can it cause lifetime problems because of the way that it hasn't been normal before?
Sure. I mean, so imagine this. So let's say your spine was damaged before you got pregnant. Now you're adding all this extra stress or weight, or you're carrying 35 extra pounds because you have a big baby. And now you already had problems. Now you had all that extra stress. Now you're going to have even more problems, and you're susceptible for even more dangerous nerve damage or nerve pinching in this area, which can lead to all kinds of symptoms. Then whenever you're pregnant, your body releases a hormone called relaxin. Relaxin it does exactly what it says it is, right? It relaxes the ligaments in your body. And it's designed to relax the ligaments in the pelvis area to help get you ready for the delivery process, so the hips can expand, so you can, deliver the baby through the birth canal. Well, what happens if you're carrying extra weight, you have the relaxin going on in your body, ligaments are getting loose, now you have instability problems, now you have this extra stress, instability, it's causing more damage, more pressure on the nerves. That's why so many ladies develop low back pain when they're pregnant. That's why they develop so many sciatic problems. Now they give birth, and those things don't just go right back to normal. Right? So now if your hips were out of alignment because of the extra stress or the extra weight you were carrying around, now it could get stuck that way. Right? Now down the road you have back pain the rest of your life, or you have chronic problems, or you have digestive problems, or you have menstrual problems. And so that's why chiropractic care is so vitally important to, one, make sure that your baby's getting everything it needs, make sure the mom is pain-free, make sure there's no sciatica, because there's more and more moms now are having to work.
Right.
So more and more moms are on their feet carrying this extra weight, and they have emotional stress, they have physical stress, they have all these stresses on their bodies. The last thing they want to add on top of that is pain or sciatica, right? So that's why chiropractic care, that's why we've been able to help so many people.
Right.
My wife, we have an 8-month-old little baby. She was getting adjusted every week, sometimes multiple times a week, but she never had back pain. Never had back pain, never had sciatica. She was a super healthy mom, the baby's super healthy. So I'm a walking testament to, for my wife, in her pregnancy, but also the several patients that I've treated during their pregnancy and post-pregnancy, getting them back to 100%. Because after you give birth, you want to get that body back into shape as fast as possible.
Right.
Well, if you're having these pains, these aches, this soreness, it makes it really, really difficult to, Ike Shaw was here, T3, to get back in the gym and do those things. But if you get rid of the pain, now you can do those things. Now you can be productive. Now you can take control of your life and your health again.
Very
And so,
true.
yeah, so there's also a technique that a lot of people don't know about. It's called the Webster's technique. And I went to a chiropractic college where they taught us this technique. And it's a technique for if the baby is breech or the baby isn't in the proper position as they're getting ready to, you know, the body's getting ready for the delivery process. So by adjusting moms in a certain way, this Webster's technique, it can promote the baby to flip on its own and get ready for delivery and get ready and get in the right position.
Very
Yeah.
interesting.
So, I mean, there's a lot that goes into it, Marlena.
Yeah, so if you'd like to find out more information, pregnant moms out there or wanting to have a baby, just call Advanced Chiropractic, Dr. Raesz, and they're doing a special just for our viewers, $59 for 2 visits. So give them a call, and they'll explain more about it. Well, thank you, Dr. Raesz, for
you
being
so
here
much,
today.
Marlena. I appreciate it.
Very interesting information.
Yeah, well, thank you so much for having me. I love it. And anytime you want to have me back, I'd love to be here.
All right, thank you so much.
Thank you. Appreciate
And
it.
we'll be right back.